Hello, this is Rashi Sahai and you're watching Medicircle. Today on our Children's Health Awareness series, we have Dr. Sumita Prakash with us. Dr. Sumita Prakash is a pediatrician and a neonatologist in Navi Mumbai and is currently practicing in Cradle Mother Clinic. For the past 13 years, she has worked as a pediatrician and a neonatologist. Welcome to Medicircle, Dr. Sumita Prakash.
Thank you, Rashi. Thank you, Medicircle, for inviting me.
So while some schools have issued the advisories, others have resorted to opt for the online classes in New Delhi after a record in the spike of the HFMD cases. So Dr. Sumita Prakash, can you please tell us that what are the hand-foot-mouth diseases?
Hand-foot-mouth disease is a very common, mild form of viral infection. It is caused by a virus called as Coxsackie virus, which belongs to a group which is called as non-polio enterovirus. This is very common. It occurs worldwide and commonly seen in preschoolers and young children, especially among groups of children who are attending schools.
Yes.
And it is common during the time like end of summer, beginning of rainy season.
So doctor, can you please tell us that what are the symptoms of HFMD?
Hand-foot-mouth disease usually it's a very mild infection. It usually begins with a prodrome of fever, sore throat. The child may start feeling sick. And later on, after 2 to 3 days, the infection takes around, after infection, the time period is around 3 to 7 days. That is what we call the incubation period. So after 3 to 4 days, it starts developing small red spots on skins, that is palms, soles, and also on the mouth ulcers can be possible. Yes. So these later on, after a few days, it starts developing into blisters. So the main symptoms are the blisters, the rashes which the kids develop, and apart from that, they will have fever. That is in the beginning. So that is it. The symptoms are very few in this.
Is this disease contagious?
It is highly contagious, though it is very mild, but it is highly contagious, and it usually spreads among these young kids because of the lack of personal hygiene. So kids tend to put their mouth in hand. So the hands, they usually touch everywhere and they put it in the mouth. So these are the common reasons, and it spreads through droplet infections. That is like when the kids are coughing, sneezing, they don't tend to take that much precaution of covering their mouth or it spreads to coughing, sneezing, the fluids from the blisters, close contact with the child who is having this infection, and it is also spread to feces of the child, that is the stools of the child, which it can occur in the stool sample for several weeks. So generally it is through close contact with the infected child.
So does the child have any complications if he is suffering from HFMD?
Usually, to mention it is a milder form, it comes and it usually goes within 7 to 8 days. But in some immunocompromised child, there is a possibility of developing some complications. So one of the common thing is dehydration. Dehydration may occur because of the mouth sores. The child may not be able to drink enough or take enough fluids. Okay. So in that case, when the mother or the parents, they force the child to eat, they vomit as well. So that in turn adds to the dehydration. So dehydration is one of the commonest complications what we see. And apart from there are some serious but very rare complication, that is meningitis, viral meningitis, if the virus enters the brain. So if that happens, it can cause, to put it in simple words, it can cause the inflammation of the membranes and the cerebrospinal fluid, that is meningitis, and also the inflammation of the brain, that is encephalitis, which is life-threatening. But it is again to mention, it is rare.
So how long does HFMD last?
It can last for about a week, but it extends up to 10 days in certain cases. In severe cases, it may extend beyond that. In that case, you need to consult your doctor. If it extends beyond 10 days in immunocompromised child, or if a child is less than 6 months of age, usually the time limit is 3 to 7 days. The blisters start to heal during that time.
So, doctor, what are the preventive measures for HFMD?
Due to COVID, we have instilled a very good thing in our children about hand wash. So hand washing is very important for the child itself. We should teach them to often wash their hands, like while before eating food, going to the washroom, using of public things, then wash your hands. And in this applies for adults as well who are handling the kids in preschools. Secondly, the second most important thing is disinfecting the common areas in preschool areas, this public toilets, and the areas where the child share their toys, where they sit together. So these areas should have a strict schedule of disinfecting and cleaning. The other thing is the kids who are having fever, cold cough, or any kind of rash should not be sent to school for certain amount of to spread the to stop the spread of the infection. These are the precautions that should be taken to avoid the spread of the infection.
So in Medicircle, our aim is to provide the audience with much information in less time. And so today we are conducting a small question answer session from where you can answer the answers to it in 1 or 2 sentences or on yes or no.
Sure.
Okay. So the first question is, doctor, that do only babies get FHMD?
The commonest age group is in preschools, that is up to 6 to 7 years of age, but it is seen in adolescents as well. It is rarely seen in them, and it is in a very less severe form. So the mostly what the age group is where the children are in groups, that is preschools. So babies, infants, and preschoolers.
Okay. So does the symptoms of HFMD only appear on hand, foot, and mouth?
Yes, as the name suggests, it's predominantly seen in the hand, foot, and mouth. But yes, during our practice, we also see the lesions developing in the genital area, the buttocks. Also, it is seen in certain cases. It's seen on the trunk areas as well. Though majority of the cases, as the name suggests, it is mainly the mouth sores, the hands, palm, sole. That is where it is predominantly seen.
So can the child who is suffering from this disease use soap on their body?
It is better, the child can take bath, but you have to be careful that if you are applying soap, the blisters, you should be careful with the blisters and how far the child is comfortable to take a bath. So taking a bath is no issues, but you need to be careful with the blisters because the fluids, once they leak out, they are infected. And the parents who are handling the kids, they can spread the infection. So you need to just be a little bit cautious about this. Yes.
Thank you so much, doctor, for coming to our show and sharing your valuable time and insights with us at Medicircle. It has been a pleasure having you on the show.
Thank you. Thank you so much.
Thank you, sir.